Thank you, Co-Chair. I'll talk about everything except hydroxyurea. Actually, my job description was not very clear, so I decided to say what I thought you wanted us to say and put up all three names and talk about pain in sickle cell disease. Now, definitions. Sickle cell disease is SS, AS, or SC. Sickle cell anemia is SS, SC. Vaso-occlusive crisis is VOC. Okay? Transmission. Any questions on the transmission? In other words, sicklers and carriers should avoid getting married, and those are sickle cells. Definition, because not everybody is at the same level. Okay? Acute pain in sicklers. This is an event, usually comes fairly quickly, usually due to a VOC, and it's a medical emergency. One time we had a sickler in emergency. He was writhing on the floor. People thought he could control it, you get up, but he was in severe pain. A sickle cell crisis is very painful, okay? And this happens when blood vessels sickle and block, cells sickle, block a blood vessel, and leads to tissue damage and tissue inflammation and causes severe pain. You'll see an adult writhing in pain. But some have chronic pain, like this patient, who sometimes had pain due to priapism or pain due to backache. And chronic pain takes longer, and there are different reasons for the chronic pain. One reason that should be remembered is involvement of the vasa, what did I put there? Navorum, okay? Vasa navorum, because that can lead to pain due to impact on the nerves called neuropathic pain. By the way, I was given 10 minutes by the chair, so I have to stop at exactly 3. What triggers pain? Changes in temperature narrows the vessels, exercise, shortage of oxygen, dehydration leading to low blood flow, infections, remember malaria, among others. Stress. Many children come because of stress, and that triggers high altitudes. If you have to go up, be aware if you're sickler. Don't take alcohol, don't smoke. Pregnancy causes stress in both males and females. If your girlfriend is pregnant, a man can get stressed and get an attack and other conditions. Where is pain felt? Pain in the chest, many people call it the chest syndrome. Chest syndrome always bothers me because we forget pneumonia, we forget pulmonary embolism, not embolism. I remember a sickler we lost. She was a working woman. She had gone through childhood, reached adult age, and got pulmonary embolism while they were on holiday at Christmas, and the doctors there didn't know what to do, and they lost that child, a big woman of 23 or 24. That was very painful for their family. Backache. Patients who come with severe backache, sicklers, acute, have a poor prognosis. In fact, we lost one end of last year, backache, because of embolism, and they have a risk of probably thrombosis or other factors. Acute abdomen. Again, they can get thrombosis leading to acute abdomen, and some people end up taking them to surgery. If a sickler has an acute abdomen, don't call it appendicitis. Consult before you take them to a surgeon, because surgeons will open up to see, and then we find cause more problems. Priapism causes severe pain. The limbs are the ones most of you are aware of. Don't forget the hips, avascular necrosis of the hips and shoulders. That's just a schematic of the different presentations and the different areas where a person can get pain. How do we manage sicklers in pain? Number one, evaluate the pain. Is it real or not? Dr. Biereta was convinced that the patient was in pain. What he would do to ask the nurse, the say, at night. No, he's busy shopping for other patients. In fact, he goes to work and comes back and sleeps here. When we come to the wardroom, the man was good. He could convince any Dr. Biereta that he was in pain. And the other thing, he used to buy drugs for other patients and sell them. He was doing risk business, and getting them home was sometimes hard. So when a patient comes in pain, number one, IV fluids. Not to rehydrate, but to make the blood flow, okay? It's like a clogged pipe. You put in water to unclog it. And how much fluids do you give? Give them enough, okay? At least 6 units in 24 hours. And that example is a rough estimate, but to show you that start fast and then move slower. And then start analgesics while in acute. Don't send them to the ward for analgesics. This is a pain emergency. Start it as soon as possible. aim at pain relief within 30 minutes. A vaso-occlusive crisis is very painful. What drugs do we give? It depends on the patient, what they have been taking, the location of their pain, severity of their pain, and so on, what has worked for them in the past. Don't forget, Panadol aspirin still works. So when you're in a place, Panadol aspirin is a painkiller anti-inflammatory. Did you know that? It's not, everybody knows aspirin for their heart. No. There's aspirin 300 milligrams, which used to be used before your grandparents were born. It's still available. So, paracetamol, aspirin do work. If you have nothing else, use them. Paracetamol can be added to an NSAID because they have different modes of action. And there are different NSAIDs we give. And usually in many patients, this controls pain. In fact, many patients go home with ibuprofen so that if they have pain, they can take it even at home. We allow them to do some degree of self-medication. If the pain persists, we go to an opioid. There are two types of opioids. The less weaker ones and the stronger ones. We normally start with a codeine-based analgesic, but there are many trade names of drugs that contain paracetamol, codeine, and I think the third one, forgotten the third agent, it's not a muscle relaxant, but the third one as well. What is this thing you find in coffee? Pardon? The other one is sometimes caffeine in some of them. Okay? So there are many triple analgesics containing codeine, paracetamol, and caffeine. Tramadol can also be used. It's a less strong analgesic compared to others. And by the way, if you're traveling to any part of the world and you have codeine or tramadol, don't take more than 2 tablets. Otherwise, you might rot in a prison somewhere, okay? In patients where it doesn't work, we can use morphine or pethidine. Pethidine, we are using it less and less because of addiction. Some years back, we had a student at this college who had an issue with pethidine. Unfortunately, we lost him in about 4th year with issues with pethidine, and that was a very painful incident. Morphine, we now try to use oral morphine. Some patients it works, some it doesn't work, and we rarely go on to IV drugs in sicklers. By the time you need IV drugs, there's something not quite right, but sometimes, rarely, they might use it. Usually, diclofenac, we can start with IM, and that can control the pain in many of them together with IV drips. Consider the route. Morphine, we normally use oral. We tend to avoid oral pethidine. It's very addictive. 1 tablet of oral pethidine, you'll want to get pethidine the rest of your life. You can use IM, diclofenac, and pethidine. Rarely do we give them IV, but sometimes if you have to give IV and there's no drip, you can use subcutaneous if there's poor vein access. But the main thing, after giving an analgesic, don't go away. Review the patient every 15 to 30 minutes till the pain is under control. Some patients are given 1 dose and then they are left in a bed. We find them crying in tears because they got 1 dose 8 hours ago and people forgot that 1 dose is not enough. You need to control this pain. Other ways to manage the pain. Talk to the patient, listen to their fears and concerns, allay their anxiety. Some of them, I'm in boarding school and the portion beans are not good for me. They bring on my attacks. Ask the parents to take them cheese and macaroni if that will work. Some, it's a term 3 syndrome. You know, term 3 syndrome, teenagers come with all kinds of complaints. They have convinced their parents they are sick, and the doctor can't convince their parents that your children are not physically sick. And the cycle goes on till term 3 ends, and then term 1, everybody is happy again. And others, it's housework, too much housework, and so on. Others, teachers are too harsh. One girl came and said, my stepfather touches my hair, and I can't tell mom, she will be angry with me, blah, blah, blah. And advise them to drink plenty of water. Sicklers should drink plenty of water. Let them rest. Tell the school matron that probably she shouldn't do too much PE, she needs to rest. A warm bath can help. Massage and swimming is also useful for controlling pain. And lastly, prevention is better than cure. Okay. So malaria, P2 covers under primary school. So malaria prophylaxis, folic acid so that the red blood cells go up, hemoglobin is up. Drink enough water, especially in dry season. Wash hands often to avoid infection. Light or moderate exercise. Avoid strenuous exercise. They shouldn't play rugby and strenuous games. Table tennis, chess, and so on. Dress warmly in cold weather. A child should have an extra sweater or jacket at any time. Don't encourage a sickler to join the school trip to the Mohavura Peak or to Mount Everest. Make sure they get all recommended vaccinations to decrease infections, avoid and manage stress, and tell them don't smoke, don't even start. So, in summary, sickle cell disease, keep them pain-free, please, because that's the bottom line. Thank you.